Now, you have to understand that when you have a graft, that grafted area has lost its follicle, so the oil gland is gone. And so it's really important for you long term to use cream. There's a lot of good creams out there. Every survivor has their own perfect one that they'll tell you about. I love a shower oil because it's quick, it's easy. I hate being cold, and so I keep that shower oil in the shower. And right before I turn the water off, I'll put the oil on my grafts and then just kind of blot it dry with a towel. You have to be a little bit careful because the oil can get on the floor, it can be a little bit slippery. So I wouldn't recommend that for someone who's just out of the hospital. It could be too slippery, but long term, that's been my best solution because it's quick, it's easy. And that's, I mean, for most of us, right? We want quick and easy. But you do need to keep some moisture. In the winter, when the heat starts turning on, I try to put a humidifier like in my room or in my bathroom to kind of keep a little more moisture in the air, because dry air, you can just, your skin starts flaking. So yeah, you just have to, it takes I talk about maintenance, like so much about a burn injury post-hospital is maintenance. You have to figure out the things that work for you and take care of yourself. Eat well, sleep well, and that can be problematic at first. Your sleep cycle's a little bit off. Just try to find ways that gets you back on a normal pattern. And then be careful of your new skin, the donors. You just have to take care of yourself. It's okay to take some time to just really try to take care of your health and your skin and your body as you're transitioning into this new life out there. The sun, okay, so I put sunblock on my face every day, and if I know I'm going to be out in the sun, I use a very good sunblock, because you can kind of tan the grafts a little bit, but they will burn really quickly. So yeah, especially the first year, I'd say the first year, don't even be out there. Wear a cap, cover up your skin. But after a year, sometimes the donors on my legs look a little bit better if they're a little brown. So you'll figure that out yourself, but just do be careful, because if there's any kind of scar tissue, it will burn pretty quickly. So yeah, just test it. Take some time to test it for yourself and how it affects you. And don't get caught in the sun too long, and then you're going to pay for it. Long term, they do the surgeries and you think, well, now there's no more surgeries can happen because my face is the way it's going to be. Well, I had cosmetic tattooing done over a year. I went in about once a month, and I have to explain this. Like the first 10 years of my accident, I was so appalled at how much makeup I had to use. I felt like I was 20 and I was putting on makeup as if I was 80, and I just psychologically couldn't handle that. Well, what the tattooing did for me was tattooing helps to blend the scar lines. And so we have a great one in town that will work with you. You can blend across the grafts. The tattooing itself breaks down the tissue a little bit. And then all of a sudden, she gave me this kind of a general color that felt better. I could wear a normal amount of makeup. And I just felt like I was 20 and, like a normal person out there putting on base and blush. And makeup is so much better today. Back in the 80s, the makeup was not, it was cakey and yucky. Today, we've got really good makeup. And there's other things. For burn survivors, the color of clothes you wear to get your colors done is really important, because the wrong color can make the scar stand out. Mm-hmm. For me, I lost my hair, and I was always kind of blonde, but I wear a blonde wig because that affects the scars. Like, you just have to figure out what works for you. I had some advice from a lady who's burned back in the 50s. She's like, a burn survivor needs to be well-groomed, because not that you're operating at a deficit, but because there's already something a little bit different about me, I want to minimize that. And so the colors I choose to wear, I'm wearing black today, that's not the brightest color, but the kind of closed, that flattering, like the steps again, your posture, your tone of voice, all of those things just show that you're confident about who you are. And so whatever ways that you can do that for yourself, you're going to help yourself out there. Whether you're looking for a job again, or you're just trying to navigate and go to the store without being stared at, all of those things, it's important in how you take care of yourself and how you present yourself.